Okay, guys, this is part 2 of our topic. We want to talk about home care for the baby. We want to teach parents that babies cry when they are hungry, wet or cold, hot, when they are tired, or they need to be bopped. Also, encourage the mothers to breastfeed, and want to teach them how to breastfeed. It's very important to place the nipple and the areola into the baby's mouth, fully into the baby's mouth. Mothers sometimes feel sore on the nipples, so by placing the nipple and the areola into the baby's mouth, it helps suckling, and it helps with the suckling reflex and also reduce the stress on the nipple. Because babies cry a lot, we teach parents not to feed the baby every time they cry, because they should learn what the baby needs, to need to know why the baby is crying. Because when the baby is overfed or fed all the time, it can lead to stomach aches and diarrhea. We teach them how to calm the baby, maybe do some movements, rock the baby. If the baby is too warm or too cold, try to keep the baby comfortable. You swaddle the baby, wrap the baby in a blanket and bring the baby close to the body, close to this, make skin contact with the baby. Pacifiers can also help, and rocking the baby and moving around can help reduce the baby's cries. So we need to let the parents know that babies sleep up to 16 hours a day. It may not be continuously, they might wake after 2 hours, after 3 hours. So the first week, the babies will do a lot of sleeping, and they wake up frequently for a short time. Okay. Once again, remind them to place the baby in a supine position. That prevents SIDS. Okay. Don't sleep on the same bed as baby. We talked about that in part 1. And one way to help the baby relax and feel comfortable is to bathe baby before bedtime, and that provides comfort. We talked about using a bulb syringe. We teach the parents to use a bulb syringe to suction any extra mucus from the mouth or nose. Once again, you do the mouth first and then the nose. Suction the sides of the mouth, okay, not in the center, so that the baby does not aspirate or get injured. And you don't want to create the gag reflex and cause respiratory distress on the baby. So as much as possible, we don't want to block the baby's airway. We want to teach the parents that at the early, in the first few weeks and months, the baby's head remains bigger than the rest of the body, and the baby has less head control. So in order not to cause any problem or injury, make sure you support the baby's head when you are lifting the baby. Okay, they have very poor head control. If you look in your book, you'll also see the different ways to teach different holds for a baby. That's the way you hold the baby. The cradle hold, you bring them like you place it like a cradle the baby. You have the upright position, you have the football hold, and the colic hold. So usually after a baby is fed, they need to place them either in the upright position or the colic position so that they can burp. Okay, it's very important that important for the baby to burp after feeding, and that way, the baby can feel comfortable and there will be no abdominal distress. Like we said in part 1, some parents or some mothers get disappointed, maybe due to some features on the baby. One of them is strabismus or nystagmus, which may be termed cross-eye, and some mothers may feel unhappy. So you assure them that it's normal for some babies to appear like that for a few months, but after the 3rd to 4th month, it goes away. So you should try to allay their concern and reassure them that it will go away after a while. Okay. And when bathing, it's important to keep the baby clean, so they can bathe baby 2 to 3 times a week. You teach them how to test the water. They shouldn't bathe with cold water. Again, temperature should be between 97.8 to 99 degrees Fahrenheit, and test the water on the inner wrist, okay, before bathing the child. You don't want the water to be too hot so it doesn't burn the baby. Teach them also they should not get the umbilical cord wet. Try to wash, around the umbilical cord. Don't keep it wet because that's a high risk for to breed bacteria. The water temperature, is between 104 degrees Fahrenheit to 105. The other one I mentioned was Celsius. Okay, so you don't want, this is to prevent injury. You don't want to burn the baby. At the same time, you don't want the water to be too cold. We talked about cold stress earlier. So while bathing the baby, you clean from the cleanest to the dirtiest. Use the cleanest to dirtiest principle. So they start with the eyes, the face, and the head, clean and dry, and do the rest of the body, and you clean the groin last because that's the dirtiest area. Okay, and of course you've done how to bathe people, so front to back, that principle. And teach parents to not leave babies alone in the bath. You'll be surprised how people make such mistakes, walk away, and they hear baby drowns. Okay, they should not leave baby alone. Do not use lotion or oils or powders. Okay, those are risk for bacterial growth, allergic reaction. Okay, and for the powders, the baby can inhale the powders, and can cause a whole lot of things. So do not use lotions, oils, and powders on a newborn. Okay. Also on feeding, fluid intake is recommended to give 100 to 140 ml per kilogram per 24 hours. You do not give water to an infant, a newborn, a neonatal. Okay, no, don't give water at this time. And also, as we mentioned in the first part, newborns may gain 110 to 200 grams per week for the first 3 months. So remember, they lose some weight a few days after they are born, but then between 10 to 14 days, they start regaining weight. I also teach them breast milk fat is easier to digest than formula. Remember, the baby's intestines are not yet developed, so they can tolerate breast milk better than formula. So they can digest it. It prevents constipation, and it has a lot of benefits, which we'll talk about in a few minutes. So after the first 6 months, babies can be fed with iron fortified cereals. So encourage parents to feed babies at least the first 6 months, and after those 6 months, they can continue feeding up to 1 year, but they can introduce iron fortified cereals, okay, or foods that are rich in iron. So solids can be introduced after 6 months of age. And the breastfeeding mom should be taught the first 3 days, colostrum is secreted from the mother's breast, okay, and it provides immunity. It has IgA immunoglobulin, which provides immunity for the baby. That's the reason they say breastfed babies, have better mental development, and because of the bonding, you can notice that as they grow older. We'll talk about that, as we go on. So newborns should be fed every 2 to 3 hours. They should be breastfed every 2 to 3 hours because they digest very fast and they demand more feeding. And because moms do feel soreness, depending on how much milk is being produced, mom can feel some engorgement, and that will cause a lot of pain. One of the ways to reduce that is to breastfeed the baby and try to alternate the breast. So you feed on the left for maybe like 15 minutes, you alternate the breast and feed from the other breast. That way the baby can, suck most of the milk out. And if the mother still feels a lot of milk flowing, you can encourage using a breast pump to express the milk and store them, in a sterile way in a refrigerator, okay? So that provides comfort for the mother. It is okay, you teach parents that it's okay to wake baby up, especially the breastfed ones, wake them up from their sleep to feed them. That helps the mother and it helps the baby, okay? So mom can wake baby up from sleep to feed them every 3 hours or 4 hours in the night. Some parents will say, oh no, the baby is sleeping, let them sleep. For the sake of their health, nutritional purposes, try to feed baby every 3 to 4 hours. That's what is recommended. So within 24 hours, breastfed babies can be fed up to 8 times or 8 to 12 times in 24 hours, okay? So 8 to 12 times in 24 hours. So let's look at some benefits of breastfeeding. Breast milk flows regularly, and within 3 to 5 days, the mom can start producing milk. Maybe the first few days she might have a little bit. Some mothers get concerned, so they might ask you, how soon will my milk come in? You let them know within 3 to 5 days they will start having regular flow, postpartum. So benefits of breastfeeding is that it reduces risk of infection by providing the IgA antibodies, okay? So it protects against macrophages, leukocytes, and so on, okay? So, baby is protected against infection. Breast milk promotes rapid brain growth due to large amount of lactose in the milk, okay? And it promotes neurological cell building. so it's very healthy for the baby. And also the breast milk contains electrolytes and minerals. This is very, very essential for the growing infant. So once again, teach parents, mothers, that if the breast feels sore, alternate the breast and at each feeding. They can also apply milk to the nipples after each feeding. That helps to reduce moisten the nipples and reduce soreness. They can reposition the baby. Maybe they had them in a cradle position and then you change it to football hold. Just change the position. That way they can suck on the breast more. So the more they suck, the more the milk gets taken in, and at the same time it also helps protect the baby from ear infections, because the suckling action kind of strengthens the muscles in the ear, and so all this will help reduce the soreness. Another thing you need to encourage the moms is to feed babies more frequently. Okay, and they can store the breast milk, if it's still full after the baby is fed. So this helps to reduce and relieve breast engorgement. Breast milk is easy to digest, it's convenient, and it's inexpensive. Remind the new mom, that the breastfed babies may pass stools up to 2 to 3 times in 24 hours, more frequently. And breastfeeding promotes maternal infant bonding. It reduces dental problems, ear problems due to the sucking, like I mentioned earlier. When the mother is breastfeeding, teach them to maintain hand hygiene before breastfeeding. Wash their hands, wash the nipples, okay, because like we said earlier, it could breed bacteria and you don't want to pass that on to the baby. So personal hygiene is very important. Encourage mother to drink fluids and always clean the breast. And how soon should the mother start breastfeeding a new baby? Within 30 minutes of birth. Usually when the nurses clean up the baby, once they do all the procedure, first thing they do is hand the baby to the mother and have her to breastfeed. You want to teach the mothers the let down reflex. How that is done is stimulating the nipple and to produce milk, and that is done because of the release of oxytocin. Okay, and one sign of that release is when the mother has like uterine cramps when they are feeding the baby. You let them know that is normal. It's just a sign that oxytocin is being released. Okay, so also teach the latch-on position, and the pages I gave you in your ATI book will show those different reflexes. Okay. And positions. Page 185 to 186 in your ATI PN Maternal Newborn Nursing book, the little blue book. Okay, and once again, be sure to review all that. Okay, you teach latch-on position. The rooting reflex, helps the baby to latch on. The rooting is like you stroke the baby's cheek with the nipple, and the baby turns its head toward the nipple, and subconsciously they know where to turn to. They just latch on. And again, be sure you teach that the nipple, the areola are covered by the baby's lips. They are able to suck better. So the rooting reflex, that's rooting, helps the baby to latch on. Okay. You can teach them to breastfeed about 15 to 20 minutes per breast. Okay, each breast 15 to 20 minutes. So mothers should feed babies at the very least 30 minutes. So you change breasts, that way there is no engorgement on the other breast. Remember to teach them to burp the baby. Okay, and expect 6 to 8 diaper changes every day, because they feed a lot, they void a lot. And teach breast pump, how to use the breast pump and express milk. I had mentioned earlier how some parents feel disappointed with baby's appearance, maybe because of the shape of the head or something they don't like. Baby does not look exactly like what she saw in the magazines. This is called inhibition of parental attachment. Okay, so when you see a parent like this, we will try to be supportive and teach them what these different things mean. Maybe Mongolian spots, we talked about that earlier. So for bottle-fed babies, the mothers may have frequent engorgement of milk. So we teach them to wear tight bra in the day and night. So that helps to compress the breast and reduce the filling with milk and reduce stimulating the nipple. Another way is to apply cold packs to reduce discomfort and reduce milk production. Because if they are not feeding the baby, they still produce milk. If they are not breastfeeding, that's what I mean. They still produce milk and they might feel discomfort. So that's why you teach them. Wear tight bra, if it's still wear tight bra both day and night, and that helps to compress the breast and reduce the discomfort. Or they can apply ice packs to reduce the discomfort and milk production. One other thing I missed out earlier is that you give oxytocin, metagene. Okay, that's what you give a woman postpartum, and that the purpose is to prevent hemorrhage. You don't want any bleeding, because that's a complication. So oxytocin is given, and that helps with contraction and helps expel whatever is left in the womb, in the uterus. So be sure to check blood pressure before giving this medication, because it's contraindicated if blood pressure is high. Okay, elevated blood pressure should not. A woman with elevated blood pressure should not be given metagene. Further investigation needs to be made. Okay. As I told you, page 185 to 186 in your ATI book, you want to know all those reflexes: Babinski, Moro reflex, Stato reflex, sucking reflex. Okay, you want to know all those. And I posted the PowerPoint on care of the mother and the newborn in your portal. So once you look at it, it's not too many slides. So there you have more information on the mother postpartum. Okay. Most of them were discussed in class, but please look at those. Okay. We also want to know the patient teaching. Some of the things I discussed on video are also on the PowerPoint. So please try to play this video and read the PowerPoint. That will help you in your test and knowledge of the topic. Okay, I wish you the best. Thank you.